Got an eclectic talk today. I'm going to speak off the camera real quickly, so I close the door so we don't get interrupted. I picked my topic, change in medicine, and then it evolved into what you got today. So we got an eclectic discussion, but I'm going to kind of start forward on that. Disclosures. I have no disclosures. Nothing exciting in my life other than we're just surviving like the rest of you guys. Objectives is what I kind of morphed into, and I divided that down in my three bullets. Is discuss how changes in medicine impact the approach we have to care, recognize that context of change impacts care delivery, and recognize internal bias as a factor in the change model. And to some extent, I call this change in medicine, but it's really almost a discussion of change in general, and it really has a little bit broader context on what you might be able to do. I kind of came up with more. I'm gonna call this my vernacular of the objectives. It's basically welcome to an eclectic discussion of change theory and change model, how this impacts us as individuals. More importantly, how we can impact that change as we go through changes. How to become an active participant to the change that is inevitable rather than passively reacting to this change through forced adaptation. I pulled I guess it's sometime last year I did a talk on art of medicine versus the science. And when I started to do this talk, I was going to pull together a mini timeline very quickly because we all know that change occurs so dramatically quicker. You go to what was in the world of medicine in the Egyptian phase, you go up to just moving on and on and on. When there was surgeries, when there was antibiotics, and now it's just an exponential. And this is just a reminder that we as physicians, or we as individuals, anybody within the realm of medicine, there's our knowledge potential. It just stays there. And at some point it crossed over, and data and technology just have been exponential. So what that does mean is, one, there's going to clearly continue to be change driven by data and what we know. And that change is going to be faster and faster, and probably, potentially, depending on who you are, where you are within the medical field, or what your role is as a care provider, or not even just a provider, just all of us within their staff as well. It's going to impact, all the differently. So change, I figure, well, as with many things, let's just come up with a definition. So definition I came up with is off Merriam-Webster on the online, just because everything else is online. And it's to make different in some particular. That's definition one. Definition two is to make radically different. And that's probably the definition of change, which scares us all and impacts many of when you use the word change, when things are happening, what that means. And then the third is to give a different position, course, or direction to. And in many regards, when we do look at evolution of medicine, change in time, really the third definition, I think, is probably what we ought to focus on. That we're looking for different position, course, and direction, rather than just making radical changes. Change through the lens of self. Kind of when I did a little Googling on what changes in medicine, you come up with the Journal of Business Psychology, had a great quote on one of their studies that basically change is more likely to lead to stress when the change has consequences for matters that are central to the employee's sense of self, particularly when the personal self is salient. This is mediated by feelings of uncertainty. So that change always, it gives kind of a gut feel, is there. But how can we focus differently? How can we look at change a little differently? I think the other piece was I did a little bit more looking. There's a model for change, a step model of change by a guy, Kurt Lewin. I believe he's a Polish fellow that was early part of the 20th century. So a lot of this has been applied to some of the nursing changes. And basically, he described unfreeze, change, refreeze. And I think if you think about it, you get into a stable environment. That's where we start. We see a need for a change or a modification. We change it, we modify it, and then the refreeze. The only thing that bothered me when I looked at this is it's a rather digital. It's you're either changing or you're not changing, and you're really striving to the status quo. And when you go back to the slide where we show how fast data is changing, and what our means are. I would argue that this timeline really gets compressed, and almost to the point that it's a feedback loop. I probably should have drawn a little picture on there where you go from here right back to the beginning, because you need to really constantly be in this phase of reevaluation and modification. I didn't really start with the beginning of this. It was very ironic with my title that this is the week that Tanglewood's coming up and live. So, but a lot of changes this week. So maybe that's a good reason to have this title. Pulling a few quotes. There's a guy, Peter Drucker, who does a little bit of analysis and has some great quotes about the business world. And often when we're looking at change, I think this is a little bit of an interesting quote. Not necessarily looking at what's right, but what we're try to well, not who's right, but what's right. What is the right course of action? And you find out by listening as much as by doing. So I think that was interesting. And this is kind of a segue off the main discussion of change, because when we do look at change, you have to look at the context of individual. This is where we can get argumentative who's right, whereas what's the right. When we start taking another step back and look at it, when it's a big health system such as ours, a big business, there's a lot of different personalities. And so I threw in this slide just to remind us, we all know that there's different people, different phases of their careers, but it's interesting that you look at how people interact. And I just thought this came out of a team building program that several of us went through at Team Steps with American Hospital Association, AHA. And I think it's interesting, what is a maturist? I'm going to call those the mature group in our providers, the baby boomers, Gen X, how do they look at things? What are the formative things that have been in their life? After this past weekend, it's really, that 9/11 was a reminder of many of what's been formative to all of us in the recent years, but that the different age groups come through, different generations. And you look at some of how it triggers how we might interact. What are the main products? What are the communications, and how is that going on? And often when we're trying to formulate a change plan, have to filter what the suggestions are, what the plans or proposals might be based on how they're presented, perhaps. I give away, I fall between the baby boomers and the Generation X, probably a little bit in there. And so when somebody comes up with a great idea, they may just, if they copy this little quick text or poke, or you're not sure what to make of it, you need the more information. But just remembering how each of us processes ourselves, and how it may be kind of coming to us does have a big factor on how we process information. Going back more towards the concept of change, I think there's a guy, Simon Sinek, who has this comes out of his Golden Circle, which is out of multiple TED Talks and other programs online. He's a very enthusiastic speaker. So if you take anything out here, you want a more enthusiastic speaker than me, please look Simon Sinek up. In particular, if you look at the Golden Circle, it's really intriguing. He gives some very great examples of some companies out there on there. And what he describes, these are the different things that as I'm going to call us a business, the medical model or whatever, the why, the hows, the whats. And I think he really points out, and he draws it as a target, because what is what we do? Well, each and every one of us, I think, is pretty clear what we do. I mean, I go see patients in a room. That's what I do. The nurses that support me, they're doing that same thing. It's a lot of a picture there. But I think, then you start asking, well, the how. Well, most people know, but not everybody may know how we deliver our healthcare product. But the most important question is really the why. Why do we do this? And I think so often we get blinded by the what. We just go about the what. And the true passion of what we do really comes from the why. I think really need to focus on that when we start figuring out what do we want to do. And if you're going to make a change in a system, why do we make that change? Why do we do what we're doing? And if we know why we're doing what we're doing, then we make the change to support that. That's where our true passion comes from. And Kind of moving to the next slide gives a different breakdown in my mind. Ownership versus buy-in. Are we invested? Are you invested in what you do? Are you invested? Do you wake up happy and excited about going in? Or do we just trudge through and get told this is how we do X or Y and move on? And really, the difference is the ownership in my mind. This is not pulling from Simon Sinek. It kind of comes across other areas. But the ownership piece is the why. It's where the passion comes from. What we do is when we buy in. Now, one of the things I promised myself as I went into this is I wasn't going to talk too much about COVID. So I'm going to break my rule in a minute and kind of come to some of those. But remembering these concepts, why versus what, ownership versus buy-in, and how that has to do with change. If I think about some of the really tangible impacts of change that we can have on a really individual level. Now, of course, some of this is really particularly geared towards general peds because that's where I live my life. But, are we looking at a what to why or a why to what when we do some of these things, like vaccine education in the face of public misinformation? And there's so many examples we could give of this. But do I go in the room and I'm going to use Gardasil, the HPV vaccination? And if I use it as a what, your kid's 11 years old, you're coming in for the other vaccines here. This is what we do. We give this one as well. And I think that's an important message. But, you wonder if so much of that discussion came out is when I walk in the room and I say, hey, so we're 11 and I got this vaccine that can prevent cancer, so many cancers in your child. And then you get to what you want to do. The message becomes a whole lot different. Again, if you go back and watch Simon Sinek, he does a great example of Apple and we make this great computer versus, we really want to make things tangible, the passion. I'm not an Apple person, but it's a great ad anyway. It's not really an ad, it's his discussion. Other areas, and you go back to the vaccine, we could use that on the COVID discussion. That gets a little bit tougher when I'm sure all of us have been probed by either somebody we know or really believing that there's a microchip in there. I've had a few of those. But use of validated screening measures, maternal depression, the ages and stages that we're doing in general peds, looking at development. If I look at myself as the mature provider and I look through that lens entirely, that's me doing what I'm doing. I screen on my own. Well, why do we do this? Well, because so many of these measures have been shown to be effective and shown to be validated. Anybody online who's a general pediatrician and general peds and looked at it at PHQ over the past year and a half, I'd challenge you to say that you weren't surprised on a few of those PHQs, that if I went on my clinical acumen, I would have said these children are fine, these adolescents are fine, and they aren't. We've learned that. And again, I'm not going to mention the reason why that is because I told you I'd have 2 slides later for that. But, if we kind of rest on our own laurels, well, the other piece is we're very much a piece of what we do is certainly why is to take care of the children. Part of it is we got some passion in education. Some providers are certainly more geared towards the educational piece, the teaching piece. But if part of my enthusiasm is to have a PA student or VTC student or nurse practitioner student in the office with me, why am I doing these things? I'm doing these things to teach them and to make sure that my patients are getting quality care. Defining, procedures and protocols. Again, based on best practice, I can ride on my laurels where I can look at, they are defining ways to handle the febrile neonate. Maybe, everybody doesn't go to the hospital for 3 days like they did when many of us were in early practice and residency. So kind of looking at some of this stuff. And then, the other piece to look at here is impact. The impactful change can impact change as well. Just because if we kind of open our minds and go with that why, it helps along the way. So kind of shifting gears a little bit to, change your viewpoints, the viewpoints of change. You can look at what have we done in the past, what are we doing now, and where's the future hold. And I think I saw a great talk by Ken Kaufman, and he describes it more as the now, near, and the far. And I think if you look at that, take a little context of that, again, the past, the now, what got us to the now was fairly slow to change. But the timeline of the 21st century is at warp speed, as we all know. So I think I'm going to kind of shift a little bit of talk towards that now near far, how that drives and how can that drive, maybe how we can make that work as a driving factor for us as we look at this. So here's my no COVID slide that says I don't want to talk about COVID, but the problem is COVID happened. The now was thrust upon us in the healthcare system, and it's pervaded every aspect of care. Near, how could you conceive of a near? I didn't know what the testing center was going to be like in 2 weeks and 4 weeks. I didn't know what my needs were going to be in those same time frames. So it became very difficult. And the far, I mean, go back a year ago, was anybody thinking about where are we going to be and how we're going to emerge from this and whatnot? But I think I came across, so really kind of a stall mode was what COVID made most of us feel, and probably still to some extent. But if we take the lens of COVID, this comes again from a little bit of a webcast by Kenneth Kaufman. The stubbornly persistent effects of this pandemic remind us that the organizational goal of 2021 is not to find a way back to the pre-comfort zone. So all of a sudden, what are we coming out to the pre-COVID? But rather than negotiate and navigate toward being the best performing healthcare organization possibly within a fast-changing, uncertain post-COVID business environment. So I'm going to argue it's not the lens of COVID, it's the focus of COVID has to change, where we have to go to, let's revise that now near far. We need to look at what the future really does, what the future is. We're not going back to where we were. Time moves forward. So factors that impact, pulling from some of those talks from the Kaufman Institute, you need to know the why, and you need to have engagement. If we don't know why we're doing anything and we don't get engagement, it's going to be pretty hard to change. Need to develop a very clear vision of FAR. I don't know whether you'd call the Tanglewood, when it got announced 2 years ago, a FAR, but I think it certainly, it was becoming there. So there's many visions of where Carilion's aiming. I think it's the Vision 2025 is often what we hear as we're getting the potential chair candidates come in. That's what they're asked to speak to. But have a vision where do we want to be, and what's your role going to be, and what role is your organization going to play in that FAR vision. You have to be a top performer. We got to be doing everything. We need to really be on the forefront. I think this is again highlight in the opening of Tango as kind of being a hub of Carilion Children's. I think we got a huge potential there to become a top performer in the now, and the near's coming up. I mean, as we open more avenues of access to care, I think we're gonna look more and more attractive on there. So, and then basically other things are kind of in the financial money, value killers. Are we doing things that are just because we've always done them? And you ever need to be cost conscious. There's no doubt on that. As that gets tighter and tighter, insurers are reeling in costs more and more as well. And reduce the complexity and friction of care models and customer experience. If it's a real boggling piece. I'm going to use Jefferson Plaza's phone system as a great example of complexity, and I'm going to use the Genesis system that's coming at Tanglewood, which is going to be real-time live people getting you where you need to be. Sure, there'll be kinks to work out, but I think we've all had multiple phone trees, and that bogs down the getting the patients the care they need and also the customer experience. Then, if we're going to have a FAR that's a clear vision and we're going to be doing something now, we've got to be ready to move into the now to the FAR. So you got to have a vision on how we're going to pay for that and how we're going to do that, and then get expertise. You need the experts. You can't just bumble in. If you got a vision of FAR that's going to be big, we've had so many. I'll argue we got a lot of experts that have gone into that Tanglewood project. So many program coordinators and so much project development. It's been amazing to see that evolve. And then reorient culture and leadership. But basically the culture of now is not the culture of the FAR. Everyone needs to be aligned around the purpose, the path, the pace. Again, the why. We need to have that engagement, or we need to really be a piece of the why. And if it's not the why that for you, then you question it, where do I fit into that why, and how is it going to work, and what can I do to get engaged? There's going to be risks from the longer time frame, and there's going to be some not perfect experiments. I hated to use the word fail, which Kaufman used, but I threw that in there. Viewpoint. Why does this change not work for me? This is one of my favorite quotes, and I'm gonna take credit because I believe I came up with this, and I've taken a lot of these. Why does something not work for me versus how can this change work for me? If the model is moving forward, how can I fit into that? How can that fit into my style of practice, my lifestyle, my work-life balance? So, very important questions to ask. I mean, the second one in my mind, rather than shift from the first to the second. Closing up with a couple of quotes. I think Peter Drucker, this is my absolute favorite quote of his, is the greatest danger in times of turbulence is not the turbulence, it's to act with yesterday's logic. So again, change is inherent, not to go backwards, it's to go forward and to look at it in a fresh perspective. And then last, got to finish on one musical note. It's not the note you play that's the wrong note. It's the note you play after it that makes it right or wrong. So in other words, the change you make when you change from one note to the next. And hopefully the tune we're playing is music to the ears, even in the eyes of Miles Davis. And I think